Hey everybody, how you guys doing today? Jim Prusak here from the Pain PT. Hope everybody's well out there and working through your somatic symptom disorder or your somatic symptoms or neuroplastic symptoms. Today we got evidence of the week, and today we're going to talk about a paper from 2022, and the title is The Longitudinal Relationship Between Emotion Regulation and Pain-Related Outcomes. Results from a large online prospective study. This is in the Journal of Pain. Okay, so emotion regulation and pain-related outcomes. We talk a lot about emotions here on the channel. Emotions are an important area that contribute to and cause somatic symptoms in the body, as well as emotional experiences. It says here that in this paper that research has consistently shown that how an individual approaches managing the emotional aspects of pain, especially pain catastrophizing and pain acceptance, reliably predicts future pain-related outcomes. So you got pain catastrophizing over here, and you got pain acceptance here. These are very opposite approaches, right? Obviously, you want to move towards pain acceptance and away from pain catastrophizing. But we're also going to look here in this study. What they looked at was they said it was unclear to the extent in which an individual's approach to managing emotions more broadly relates to pain-related outcomes. So our ability to distinguish, our ability to identify, acknowledge, label what we're feeling emotionally on a broader level. In this study, they wanted to see how that impacted pain-related outcomes. Again, emotion regulation, what is it here? It's a multifaceted process of altering one's emotional trajectory towards a desired state. It occurs first by identifying one's emotional state. Right? So it's the first thing, and that's called affect labeling in the research. I'll go over some research around that another day. But labeling, identifying, acknowledging what we're feeling. And then next, engaging in strategies to either downregulate the emotion, right, if it's a negative emotion, or possibly upregulate the emotion if it's a positive emotion. And this can modulate the intensity of the emotion. We know here that pain catastrophizing, here we talk about that. That's negative thinking, that's fear-based thinking. Okay. And they say there's an exaggerated negative cognitive orientation towards the pain. Often emerges as an attempt to downregulate the fear of pain. So catastrophizing is related to fear, to that emotion. And believe it or not, people catastrophize as a way to help downregulate the fear. But that doesn't work. I can talk about that another day, but it doesn't work when you catastrophize. It actually increases the fear and it increases pain-related outcomes as well. Okay. Pain acceptance, which is the opposite of pain catastrophizing, it's a tendency to engage in valued activities despite pain, can be employed to downregulate the fear of pain, okay, by acknowledging uncomfortable emotions and engaging in goal-directed action despite them. Right? As they say here in the paper, that greater use of pain catastrophizing relates to the development, persistence, and severity of chronic pain. So we have studies showing that. We also have studies showing that chronic pain acceptance, on the other hand, is associated with lower pain intensity, improved pain-related functioning, and improved psychological well-being. So already one of the takeaways here is that we want to be moving towards pain acceptance and away from pain catastrophizing as a way to deal with the pain and the emotions that come with it. But when we look at general emotion regulation strategies, this is more broadly now. In this study, they want to see the impact of that because it hasn't been studied quite as much as pain catastrophizing or pain acceptance. So they wanted to see if general emotion regulation strategies helps explain pain-related outcomes over and above these pain-specific emotion regulation, the catastrophizing and the acceptance. And it may represent a broader treatment target that can improve both pain and mood-related outcomes relevant to people with chronic pain. So in this study, they had a pretty large group of people, almost 1,500 people, 1,453 participants. All of them had different types of chronic pain. Okay. And what they found here, looking through their data here from the results was that the current study was looking to determine the extent to which general difficulties with emotion regulation were associated with pain severity and pain interference 3 months later, okay, above and beyond the catastrophizing or acceptance. And again, this was done in a large sample of adults with mixed chronic pain conditions from the community. And what they found here was that greater alexithymia, you heard me mention this word before. If this is your first time hearing it, the word alexithymia literally means no words for feelings. Having difficulty identifying what emotional feeling you're experiencing and the ability to register that and acknowledge and know that. That's called alexithymia. And what they found here was that greater alexithymia, difficulty identifying and describing one's emotions, emerged as a statistically significant predictor of pain-related outcomes. And we've seen this before, and I've mentioned this before, and I'll do this on another evidence of the week. It's very powerful data. The findings suggest that alexithymia may be valuable to assess alongside pain-specific emotion regulation strategies. And that is something I test for and screen for in people that I work with. And it shows up in, again, close to almost 50% of people, they say, have alexithymia. And again, here it reflects difficulties with the first stage of emotion regulation, alexithymia, which is emotional identification, knowing what you're feeling emotionally. And this is really important, everybody. This also speaks to what we call emotional granularity, which I'll talk about in another evidence of the week. This is knowing very specifically, very nuanced how I'm feeling with the right words. Hey, I'm disappointed, or I feel frustrated, or I feel ashamed, or I feel guilt. Right? Being able to put the right word to the feeling. And alexithymia is a difficulty with that identification of what am I feeling? We know here, again, they say in the paper that people with chronic pain report higher levels of alexithymia. Like I said, upwards of 30, 50 plus percent of people. And alexithymia is related to higher pain severity and pain interference and greater depression and anxiety. Okay, so it really does feed into pain, anxiety, and depression. Remember, anxiety and depression in and of themselves aren't true emotions. They're emotional states, but they don't actually describe exactly what emotions we're feeling. So alexithymia could actually cause and create more anxiety and depression. And consistent with the present study, other studies have found that alexithymia predicts poor pain-related outcomes. And this current study extends the prior work of these things here. Okay, and once they brought alexithymia into the mix, um, the pain catastrophizing that they found and pain interference actually dropped off as being significant. So this alexithymia sort of emerged as a variable here to look at with general motion regulation. And what they say here is that elevated alexithymia may capture a broader and more robust emotion regulation difficulty that contributes to the difficulty of functioning despite chronic pain. And that they say here that pain demands attention, right? So when we get a pain or symptom in the body, right, it demands our attention, it draws our attention in. And it says particularly when the threat value associated with pain is high. You guys know I always talk about the threat value. When you give the pain or symptom a lot of meaning, it means it has a high threat value. It means you're going to have greater attention towards that symptom. And it says your hypervigilance towards pain may detract attention away from relevant affective cues, which are known as emotional cues, hindering emotional awareness and contributing to poor pain-related outcomes. So this kind of alludes to what the Dr. Sarno said, that the physical symptom acts as a distraction in a way from maybe the emotional content going to the emotion. And especially when we think the symptom is threatening, demands our attention, which is called hypervigilance, and that might detract our attention away from anything that's emotional. So we want to look into broader emotion regulation skills to counter alexithymia, right? So this is some of the work that I do here is to get people a greater awareness of their emotions, to be able to identify, acknowledge, express those feelings more generally, and to connect them when you're having somatic symptoms, that what it could be representing. They also found that pain acceptance here in the study was it remained significantly associated with pain-related outcomes. after accounting for general emotion regulation. So the pain acceptance was still something that we want to be able to do. So out of this paper, we got two things, right? Two things you guys can take away that I'd like to teach and work on. One is pain acceptance, and the other one is building emotional awareness, identification, recognition, acknowledging and expressing your feelings, okay, to counter alexithymia. They even gave a shout out here to EAAT, which is emotional awareness and expression therapy, as started by Dr. Howard Schubiner and Mark Lumley. Okay, and they mentioned here that in some of the data, and we have some of that data, that there's value in EAET, okay, and that they found some better effects than CBT, better outcomes than using just CBT, cognitive behavioral therapy. I'll talk about that again in another evidence of the week. So I hope this is helpful, everybody, to dive in again to chronic pain in almost 1,500 people, different types of chronic pain, emotion regulation strategies, how people deal with the pain, pain catastrophizing, pain acceptance, and then this broader state of how we deal with just general emotion, which is linked to this alexithymia, which is having difficulty identifying, acknowledging, and expressing what we're feeling. Identification, that's your first stage. And if we can improve that, as well as improving pain acceptance, those are two things that can go a long way to helping to reduce the intensity and the severity and the prevalence of chronic pain and other chronic symptoms. If you guys like the video, please give it a thumbs up. It helps spread the word. Other people can learn about this information, this research, this knowledge. If you do want more help in understanding emotions, understanding if your condition is neuroplastic and what you can do about it, I offer consulting. I offer individual assessment, group coaching. You can go to my website, thepainpt.com, and we'll see you guys next time. Take care now. Bye-bye.